fortunate, Chingura. I am the chair of this first International Climate and Health Africa Conference. This is the first of its kind, primarily because it brings together policymakers and legislators on the table to start engaging with the scientific evidence that's emanating from the various pieces of work that's happening across the region. But also there's a critical component on capacity building that we're investing in. You may well know that we have about 60 early career researchers that have been funded by Wellcome Trust to come and attend this conference from over 40 countries. And also the policymakers that are here representing about 36 governments have also been supported to come here, with the 21 ministers and their representatives also here through that support. But all in all, we're looking at about 400 global participants that are here to attend this first International Climate and Health Africa Conference.
This conference is extremely important because it's calling attention to a threat, I think the highest, the most important health threat of the 21st century. Climate change is driving a very large burden of diseases, many of them re-emerging in this region. But there are many other factors that are also being affected by climate change. For example, we're experiencing cyclones that are lasting for longer periods than usual. We're experiencing flooding. We're experiencing droughts. And both of those extreme events lead to outbreaks of diseases such as cholera, which are affecting very large proportions of the populations. We have heat waves, the increasing temperatures in our region are causing droughts of unprecedented events. We have right now in the Horn of Africa a long-running drought that is driving a lot of people into lost livelihoods, malnutrition, migration, with all the problems that come as a result of the displacement of persons. So the problems are multiple and huge. We in the health sector are very concerned because there are many factors that are being driven by climate change which affect diseases and health conditions that then end up in the health sector. So what we are here to talk about is why it is extremely important to, first of all, tap into the transdisciplinary knowledge that is coming out of the discussions by the scientists and researchers, using that information to address the lived and experienced problems that communities can tell us about in very perfect terms, and to also encourage the policy makers to see what the evidence is telling us, what the people are experiencing, so that the policies that we put in place in terms of development, agriculture, health, commerce, industry, transport, all those, the way we construct housing, the facilities around housing, sanitation systems, water systems, all those are systems that need to be strengthened so that the impacts of climate change are minimized.